This presentation will outline the packaging requirements for adult daily multivitamin supplements according to good manufacturing practices. A multivitamin is a preparation intended to supplement a human diet with vitamins, dietary minerals, and other nutritional elements. Most multivitamins are available in the form of tablets, capsules, powders, and liquids. A multivitamin in Canada contains 2 or more vitamins and minerals, but does not contain herbs, hormones, or drugs. Each vitamin and mineral that is included in the multivitamin must be at a dose below the tolerable upper level for that specific ingredient. Some common multivitamins that are familiar to Canadian consumers include the Centrum line of products, the One A Day line of products, and the VitaVim line of products. There are also specific multivitamins designed for expecting mothers under the category of prenatal multivitamins. In Canada, multivitamins are a natural health product and are therefore regulated under the Natural Health Products Regulations. These regulations apply to the sale, manufacture, packaging, labeling, importation, distribution, and storage of natural health products. The Natural Health Products Regulations explicitly state that the provisions of the Food and Drug Regulations do not apply to natural health products unless it is otherwise indicated. Part 3 of the Natural Health Products Regulations includes the good manufacturing practices for natural health products, which include multivitamins. Section 43 of the NHP GMP Regulations states that no person shall sell a natural health product unless it is manufactured, packaged, labeled, imported, distributed, or stored in accordance with these regulations.
There is a separate labeling and packaging section for NHP Good Manufacturing Practices Regulations. Section 86 of the NHP GMP Regs state that no person shall sell a natural health product unless it is labeled and packaged in accordance with these GMP regulations. Section 87 states that information respecting a natural health product shall be in both English and French for recommended conditions of use, the common name and proper name of each medicinal ingredient, and each non-medicinal ingredient that it contains. A description of source material of the medicinal ingredient and its storage conditions must also be included. Section 88 of the NHP GMP Regs state that statements, information, and declarations required by these regulations to be shown on a label of a natural health product shall be clearly and prominently displayed and be readily discernible to the purchaser or consumer of the natural health product under the customary conditions of purchase and use. Regulation 89. If a natural health product has only one label, then that label shall show all the statements, information, declarations required by these regulations on both the inner and outer labels. Regulation 90 states that every lot number on a label of a natural health product shall be preceded by one of the following designations: lot number, lot NO, lot, or L in brackets.
Regulation 91 states that every product on a label of a natural health product shall be preceded by the designation NPN. Regulation number 92 states that there shall be no reference, direct or indirect, to the Act, the Food and Drug Regulations, or to the NHP regulations made on any label of or in any advertisement for a natural health product unless the reference is specifically required by law. Regulation 93 requires that the inner and outer labels shall show the following information in respect of a natural health product. The principal display panel of the product must contain a brand name, its product number, its dosage form, if it is sterile, the word sterile, the net amount in the immediate container in terms of weight, measure, or number. Also, on any panel of the product, the following information must be provided: the name and address of the product license holder, if it is imported, the name and address of the importer, the common name of each medicinal ingredient that it contains, the proper name of each medicinal ingredient it contains, but only if the proper name is not the chemical name, a list by proper name or by common name if the proper name is the chemical name, that sets out the quantity of each medicinal ingredient per dosage unit, and if any, the authorized potency of that medicinal ingredient, its recommended use or purpose, its recommended route of administration, its recommended dose, its recommended duration of use if any, its risk information including any cautions, warnings, contraindications, or known adverse reactions associated with its use, its recommended storage conditions if any, its lot number, its expiry date, and a description of the source material of each medicinal ingredient that it contains. The outer label must also show a qualitative list by common name preceded by the words non-medicinal ingredients of all non-medicinal ingredients of the natural health product. And if the natural health product contains mercury or any of its salts or derivatives as a non-medicinal ingredient, a statement that sets out the quantity of mercury contained in the natural health product.
There is a section on security packaging in the Natural Health Products Regulations. Section 95 of the NHP regulations states that no person shall sell or import a natural health product unless the natural health product is contained in a security package. Another requirement is that a statement or illustration that draws attention to the security feature of the packaging shall be shown in the inner label, and if the security feature is a part of the outer package, then the illustration shall be on the outer label. However, this does not apply if the security feature is self-evident and is an integral part of the immediate container. The NHP regulations also contain a section on cautionary statements in child-resistant packages. In this case, the Food and Drug Regulations requirements for cautionary statements and child-resistant features also apply to natural health products. Regulation number 97 under the NHP regulations outlines the detailed requirements for these two features. Multivitamin product manufacturers must also comply with the requirements set forth by Health Canada in the Multivitamin Mineral Supplement Monograph. This monograph is intended for multivitamin, multimineral, or multivitamin and multimineral supplements that contain any two or more medicinal ingredients. The document lists what label claims and information that multivitamin mineral supplement manufacturers must claim on their packaging materials. For products that contain only a single vitamin or mineral as their sole medicinal ingredient, manufacturers must refer to the appropriate single ingredient monograph. Vitamins that are covered by the multivitamin mineral supplement monograph are shown here in this chart. The minerals are covered by the multivitamin mineral supplement monograph are shown here in this chart. Other medicinal ingredients covered by the multivitamin mineral supplement monograph are shown here in this chart.
The multivitamin mineral supplement monograph includes information on dosage forms, general and specific use or purpose statements that can be claimed on multivitamin packaging materials. For example, if a multivitamin contains vitamin C as one of its medicinal ingredients, the manufacturer can claim on their packaging materials that their product contains an antioxidant for the maintenance of good health. There are specific use or purpose statements for minerals too. For example, if a multivitamin contains calcium as one of its ingredients, then the manufacturer can claim on their labeling materials that their product helps in the development and maintenance of bones and teeth. The multivitamin mineral supplement monograph contains valuable information on dosage. The daily dose of each medicinal ingredient must be at or above the minimum dosage value and at or below the maximum dosage value. Each life stage group has its corresponding minimum and maximum dose of each vitamin and mineral listed in the chart form. Life stage groups are infants 0 to 12 months, children 1 to 8 years, adolescents 9 to 18 years, and adults 19 and older. For example, if a multivitamin product contains zinc as an ingredient, then the minimum daily dose of zinc for an adult is 0.7 milligrams per day, and the maximum dose is 50 milligrams per day. There is also a directions for use section. For example, if the multivitamin contains calcium, the following statement is required on the labeling material. Take a few hours before or after taking other medications. Certain vitamins and minerals require a cautionary warning statement on the packaging. For example, if the multivitamin product contains the mineral manganese at greater than 5 milligrams as the daily dose, then a cautionary statement must be placed on the labeling to the effect of, consult a healthcare practitioner prior to use if you have a liver disorder. There are certain known adverse reactions that are associated with some medicinal ingredients. For example, If a multivitamin contains more than 35 milligrams of iron, a statement must be placed on the packaging material stating that some people may experience constipation, diarrhea, and/or vomiting. Non-medicinal ingredients that are part of the multivitamin must be listed in the Natural Health Products Ingredients database, which can be accessed online. All multivitamin products must comply with the minimum specifications outlined in the current NHPD Compendium of Monographs. The Compendium of Monographs can help speed the evaluation of the safety and efficacy of medicinal ingredients commonly used in natural health products. These monographs can be referenced by manufacturers in support of the safety and efficacy of their product, rather than providing clinical and non-clinical evidence to the Natural Health Products Directorate product reviewers for ingredients that are already known to be safe and efficacious when used under the conditions specified in these monographs. The Compendium of Monographs can be accessed via the Natural Health Products Ingredient database.